Hello, welcome to Scratching the Surface. My name's Kamron, I'm a social work student at the University of Toronto, and I'm doing my practicum this summer at Recalibrate Therapeutic Services. In this video, I'll be talking about substance use disorder, what it is, what causes it. I'll be talking about some of the co-occurring mental and physical health conditions. I'll address the stigma associated with substance use disorder, and I'll conclude the video with some treatment approaches. Before diving in though, I want to pause and share a program that'll potentially be starting soon with Recalibrate Therapeutic Services. We're launching a new therapeutic men's group, which will be a professionally facilitated, confidential space where men can come together and talk about the issues that matter most, such as relationship stress, work pressures, loneliness, and emotional well-being. If you or someone you know is interested in joining, or if you'd just like some more information, please reach out by email or by phone, or visit our website at recalibratetherapeuticsservices.com for details on how to register. Now, without further ado, let's jump into the content today. So this is my presentation on substance use disorders, and we can begin by figuring out what a substance use disorder is. According to the American Psychiatric Association, substance use disorder is a complex condition in which there is uncontrolled use of a substance despite harmful consequences. This is the hallmark of the disorder. It's not about a lack of willpower, or moral failing, or someone simply making bad decisions. It means that the drive to use the substance has become so powerful that it overrides a person's natural self-preservation instincts, their relationships, their job, their health, even when they know consciously that it's hurting them. Now, it's important to understand that this is a chronic condition. Addiction doesn't just happen overnight. It develops over time, and it physically changes how the brain functions. We often think that once the immediate intoxication wears off, the person is back to normal. But that's not the case. The brain's reward system, its ability to regulate impulses, and its stress response system are actually rewired. These changes can last long after the substance has left a person's body, which is why recovery is a process and not a single event. Finally, it's important to recognize that substance use disorder doesn't discriminate, and it comes in many forms. We're talking about substances like alcohol, cannabis, nicotine, stimulants, sedatives, inhalants, opiates, methamphetamine, and many others. Each of these substances interact with the brain differently, but at their core, they all share this capacity to hijack the brain's reward system and lead to that pattern of compulsive use despite the harm that it causes. So now that we define substance use disorder, we may ask what causes it. This is where we move away from outdated myths about moral weakness or poor character. The reality is that substance use disorder is caused by a complex interaction of biological, psychological, and social factors. There's no single cause, and there's no single pathway into addiction. The first contributing factor on the list on the slide is genetic vulnerability. Research has consistently shown that genetics play a significant role in a person's susceptibility to substance use disorder. It's estimated that approximately 40 to 60% of a person's risk is attributable to genetics. This means that some individuals are biologically wired to respond more intensely to substances, or they may have differences in their brain's reward and impulse control systems. This doesn't mean that genetics are destiny, it simply means that some people start at a higher baseline of risk. Next, we have environmental stressors, and childhood trauma is one of the most powerful environmental causes of substance use disorder. Experiences such as physical, emotional, or sexual abuse, neglect, household instability, or witnessing violence creates lasting changes in the developing brain. These early adversities dysregulate the stress response system, making substances feel like a necessary coping strategy later in life. Then it's important to consider social pressures. We're deeply influenced by our families, peers, and broader communities. Social norms around drinking or drug use, peer pressure, and the availability of substances in a person's environment can all serve as contributing causes. If a person is surrounded by substance use and it's normalized in their social circle, the likelihood of developing problematic use increases significantly. We also look at individual personality characteristics. Certain traits such as high impulsivity, risk-seeking behavior, low frustration tolerance, or difficulty managing emotions can create vulnerability. These characteristics don't directly cause addiction, but they can make substances more appealing as a way to manage internal stress. Finally, we have psychiatric problems. There's a well-established link between mental health conditions and substance use disorders. Depression, anxiety, post-traumatic stress disorder, and bipolar disorder frequently co-occur with substance use disorder. In many cases, individuals turn to substances as a way to self-medicate the painful symptoms of these conditions. What starts as an attempt at relief can, over time, develop into a full-blown substance use disorder. The most critical takeaway here is that the most influential factor varies, and may be different for everyone. For one person, childhood trauma could be the main driver, and for another, it may be the genetic predisposition or a co-occurring psychiatric condition. There's no single cause, and that's why assessments and interventions must be individualized, compassionate, and holistic. So now that we know what causes it, it's important to recognize the symptoms. How do we know when someone has crossed the line from use or misuse of a substance into a full-blown disorder? I've listed only some of the symptoms from the Diagnostic and Statistical Manual of Mental Disorders, but there are 11 in total. The first one on the list in this slide is craving. This is more than just wanting a drink or a drug. It's a strong, intense, and often overwhelming desire to use the substance. These cravings can be triggered by people, places, or situations associated with past use, and they can be incredibly difficult to resist. Next is ongoing use that interferes with major life obligations. This means the person continues to use substances despite it causing problems at work, at school, or at home. They may be missing shifts, failing classes, or neglecting their family responsibilities. The substance begins to take priority over the things that used to matter most. Then we have using larger amounts or over longer periods of time than planned. The person may set limits for themselves, such as only drinking on weekends or only using a small amount, but they consistently find themselves exceeding those limits. They lose control over how much and how often that they use. Another symptom is a persistent desire or unsuccessful attempt at cutting down. This is often heartbreaking because the person genuinely wants to stop or reduce their use. They may try repeatedly, but every attempt fails. This isn't a lack of willpower, but rather it's the brain's rewired reward system that's working against them. We also see tolerance, which means the person needs more and more of the substance to achieve the same effect that they once got from a smaller amount. Alternatively, they may use the same amount, but experience diminished effects. The brain adapts to the presence of the substance, requiring higher doses to feel normal. Finally, we have withdrawal. When the substance leaves the body, the person experiences physical and psychological symptoms that range from uncomfortable to life-threatening. They may use the substance or another drug specifically to avoid or relieve these withdrawal symptoms, creating a vicious cycle of dependence. These symptoms together paint a clear picture of substance use disorder. It's a condition characterized by a loss of control, compulsive use, and continued use despite harm. Recognizing these signs is the first step towards helping someone get the help that they need. So now that we've discussed what substance use disorder is, what causes it, and some of its symptoms, we can now explore the co-occurring impact that substance use disorder has on an individual. Co-occurring mental and physical health conditions are often present for individuals with substance use disorder. Starting with mental health, depression is incredibly common among people with substance use disorder. Many people use substances to escape those feelings of hopelessness and sadness, but alcohol and drugs are depressants themselves, which ultimately worsens the very symptoms that they're seeking to relieve. Anxiety disorders also frequently co-occur. People with anxiety may turn to substances like alcohol or sedatives to quiet their racing thoughts. However, as the effect wears off, the anxiety often returns even stronger, creating a cycle of dependence. PTSD is another critical condition that we see, especially among individuals with a history of trauma. Substances are often used as a way to numb intrusive memories and hyperarousal. We also see high rates of co-occurrence with bipolar disorder and various personality disorders, particularly borderline personality disorder. The impulsivity and emotional dysregulation present in these conditions can significantly increase susceptibility to substance use. Now we turn to physical health. The body bears the weight of substance use in multiple ways. Chronic pain is a common co-occurring condition, and it's a double-edged sword. Many individuals with chronic pain are prescribed opioids, which can lead to dependence, while others may turn to substances to self-manage their pain. Cardiovascular and coronary diseases are prevalent among individuals who use stimulants like cocaine and methamphetamine, as these substances put enormous strain on the heart. We also see high rates of infectious diseases, such as HIV and hepatitis C, particularly among individuals who inject drugs and share needles. Liver and gastrointestinal diseases are closely linked to chronic alcohol use. And finally, we cannot overlook obesity, which can be linked to substance use through poor nutrition addiction, a sedentary lifestyle, and the use of substances like cannabis that can increase appetite. So substance use disorder cannot be treated in isolation. The mental and physical health needs of an individual must be addressed in conjunction with the substance use disorder. Treating one condition while ignoring others is a recipe for relapse and poor outcomes. So now we come to another layer of the issue that's substance use disorder, and that is the stigma associated with it. Despite everything we know about the biological and environmental roots of addiction, negative attitudes remain prevalent regarding people who suffer from substance use disorder. Too often, individuals are labeled addicts or junkies, and their condition is viewed as a moral failing or a choice rather than a chronic health condition. This stigma is not just hurtful, but it can end up in fatal outcomes. These negative attitudes create significant barriers to treatment. People who need care may not seek it because of the fear of disclosure. They worry about being judged by their families, their employers, or their communities. Even when they do seek help, they may experience poorer quality of care, and they may face reduced access to health programs, simply because of the prejudice associated with the condition. In some cases, individuals may even increase their intake of a certain substance in response to the shame and isolation that they feel. We also have to acknowledge that substance use disorder is often associated with homelessness, and the stigma of both conditions contribute to their perpetuation in society. The person experiencing homelessness is seen as dangerous or undeserving, and the person with substance use disorder is seen as weak or irresponsible. When you combine these two stigmas, the individual ends up being doubly marginalized and doubly abandoned. In these cases, we have to advocate for equitable access to treatment and remember that behind every diagnosis is a human being, deserving of dignity, compassion, and support. And now we arrive at a very important point in the video where we talk about the treatment approaches to substance use disorder. There are a range of evidence-based treatment approaches that have been shown to be effective. The bad news is that there's no single approach that works for everybody. Treatment must be individualized, and it often requires a combination of therapies tailored to the unique needs of every person. We can start with cognitive behavioral therapy, or CBT. It's one of the most widely researched and effective treatments for substance use disorders. It focuses on identifying and changing the maladaptive thoughts and beliefs that drive substance use. It also helps individuals develop coping skills to manage cravings, avoid high-risk situations, and address the underlying triggers that lead to relapse. CBT empowers individuals to recognize the connection between their thoughts, emotions, and behaviors, and gives them practical tools to interrupt the cycle of addiction. Next, we have contingency management, which has shown particular effectiveness for cocaine use disorder. This approach uses positive reinforcement to encourage abstinence. Individuals receive tangible rewards, such as vouchers or small monetary incentives, for providing drug-negative urine samples. While it may sound simple, the research consistently demonstrates that this approach can significantly reduce drug use and promote sustained recovery, especially when combined with other therapeutic modalities. Another powerful approach is acceptance and commitment therapy, or ACT. ACT takes a different path from traditional CBT. Rather than trying to change or eliminate distressing thoughts or feelings, ACT encourages individuals to accept them as a natural part of the human experience. The focus is on developing psychological flexibility and committing to value-driven actions. For someone with substance use disorder, this means learning to sit with cravings without acting upon them, and choosing actions that align more with their deeply held values, whether that's being a present parent, maintaining employment, or rebuilding relationships. And finally, we have psychodynamic therapies. These approaches delve deeper into the unconscious processes and early life experiences that shape a person's relationship with substances. Psychodynamic therapy explores how unresolved conflicts, attachment patterns, and defense mechanisms contribute to substance use. By bringing these unconscious dynamics into awareness, individuals can develop greater insight into their behavior and work through underlying emotional pain that fuels their addiction. This is especially valuable for individuals with a history of trauma or complex relational difficulties. It's important to help connect individuals to the approaches that resonate with them and their unique circumstances. Treatment is not one size fits all, and recovery is not linear. But with the right supports and the right therapeutic approaches, recovery is absolutely possible. But that's just scratching the surface. If you'd like to learn more about substance use disorder, the links to the sources that I've used for this video are in the description below. And if you or someone you know is suffering from substance use disorder or with their mental health in general, then don't hesitate to reach out to the experienced mental health practitioners at Recalibrate Therapeutic Services who can help you with non-judgmental and compassionate care. As well, if you'd like more information on the new men's therapeutic group that's starting soon at Recalibrate Therapeutic Services, then reach out by email or by phone or visit our website at Recalibrate Therapeutic Services. The link is in the description below. That's all for this video. Thank you so much for watching. I hope you learned something, and take care.